the PARP inhibitors initially were conceived of as functioning in the setting of synthetic lethality in cells that already had a deficiency in DNA repair. A second hit, so to speak, in that process would result in death of the cancer cells. However, the newer data are really looking at other mechanisms by which PARP inhibitors may have anti-cancer effect for prostate cancer patients. And so they're being combined with the androgen receptor-targeted agents like abiraterone and enzalutamide. So at ASCO 2022, we heard the PROpel data and the MAGNITUDE data. These were studies done in mCRPC, but not selected for alterations in homologous recombination repair, which again is where PARP inhibitors are traditionally used. So they're two different study designs. PROpel just took all comers, anyone with mCRPC, put them into the study and randomized them. And of course, they then were interested to look at genomics. And fortunately, the two arms were balanced in terms of who had a homologous recombination repair alteration. Since if that was imbalanced, that could have driven the study results. But in that study with olaparib plus abiraterone versus abiraterone with placebo, there was a survival advantage to using the combination. In unselected, now when you broke it down by the presence or absence of what has been a good selection biomarker for benefit to olaparib, there was a greater benefit in the patients that had that existing deficiency in DNA repair. But the overall study was positive, and even in the biomarker negative patients, it was the study favored olaparib. So looking at the MAGNITUDE study, on the other hand, this separated out from the get-go patients with a deficiency in DNA repair or a homologous recombination alteration, and randomized those patients to PARP inhibitor plus Abi versus Abi alone, and then separately randomized the patients without the biomarker. Now that arm had to be closed because of futility, so there was no apparent benefit. And that's where your question about conflicting results comes up. Certainly the results are homologous in that in both studies, there's a clear advantage for patients who have a DNA repair deficiency for using a combination of a PARP inhibitor with an AR targeted agent. And the only difference is whether that benefit exists in a broader population. So we were left with a lot of questions. Now the TALAPRO-2 study is going to report out shortly. We've heard a press release that study is positive for the addition of the PARP inhibitor talazoparib on top of enzalutamide. The study was designed as an unselected population study, so we have more to learn about the finer details, but I think that will help us to contextualize what we saw last year, which perhaps led to some confusion or some conflicting results.